Welcome to Live at Kigali 2022, Cities at the Cusp, the Nexus between Urbanization, Health, and Climate Change. I'm Terri Chapman. I'm the co-chair of the Kigali Global Dialogue, and I am joined by Jose Siri, who is an epidemiologist and a healthy cities expert. So, Jose, I want to sort of just jump right in and ask you, what is a healthy city and why should we care?
First of all, I just wanted to say thanks. It's great to be at the Kigali Global Dialogue. Really interesting set of people and perspectives, and I think I've learned a lot. So to answer your question, a healthy city is one that continually creates and improves its physical and social environment to promote health and the state of the natural systems on which it depends. More simply, a healthy city is one that's actively designed and managed for health. So we should care about healthy cities for a few reasons. One is that most people now live in cities, and that's a number that's steadily increasing. By mid-century, we expect at least 2/3 of people on this planet to live in cities. By some measurements of what cities are, it'll actually be much higher than that. Cities are now the dominant influence, the dominant environmental influence on people's lives. So we should care about healthy cities for a number of reasons. One is the health argument. So most people live in cities already, and that's a number that's steadily increasing. By mid-century, about 2/3 of people or more, depending on what definition of cities you use, are going to live in cities. So cities are now the dominant environmental influence on people's lives. Cities do tend to be healthier than rural areas, but there are wide inequalities within cities, and there are pockets of really ill health within cities. On top of that, cities do tend to leave potential for better health on the table. So just to give one example, over 9 in 10 people in the world today breathe air that doesn't meet the WHO air quality standards. It's estimated that leads to 7 million deaths a year from air pollution. And a lot of that could be avoided by effective urban health policies and practices. So that's the health argument. There's also a very powerful environmental argument for urban health. Cities are the dominant driver of environmental change in the world. They're responsible for 3/4 of all resource use, 60 to 80% of all greenhouse gas emissions. So you can imagine that it's very hard to tackle those problems without thinking about cities. And of course, those environmental and those health impacts translate into economic impacts. So very important to think about urban health, and also because we're just getting started in a sense with cities. By mid-century, we'll add 2 billion people to the cities of the world. And we're going to more than double the urban infrastructure that we have right now. So we have less than 50% of the urban infrastructure that we need for the people that we'll have. So if we manage that badly, if we let it proceed without planning, then we're going to have a very hard time managing those impacts. But on the other hand, if we do cities better, then that will open a pathway towards achieving the sorts of health and sustainability and environmental and equity goals that we have.
So it sounds like a healthy city is much broader, right, than creating a healthy, like a healthcare system that is effective and accessible in a city, right? And it involves many different urban sectors, from transportation, from all kinds of infrastructure, to addressing things like air pollution. But city governments tend to be organized around in a very siloed fashion. And it sounds like healthy cities really need to be approached, all of these sectors, through a public health lens. Is that right?
Yeah, so that's right. And we do tend to conceptualize health pretty narrowly. So when I say health, people will think hospitals or medicine or doctors.
Exactly.
And that's a reasonable thing to do, but it's an incomplete picture. The health sector is really critically important for health, but it's only part of what determines our health. In fact, health is an emergent product of our experiences in the environments in which we work and live and play. And what that means is just about any action that we take in a city, in or around a city, in whatever sector that we're working in, is a potential health action. Every action has a potential health cost or dividend. And in what I think is quite a deep way, that means that all of us working in cities in any capacity are urban health workers. Now, unfortunately, that's not the dominant conception of health. And so what that means is that when you do have very siloed city governments, there's a tendency for decision makers in other sectors to say, well, why should I worry about health? That's not my area. We have people that work on that. We'll let them work on that. I'll work on what's within my remit. And then you get decisions that either aren't supportive of health or in bad cases, actually have negative impacts on health and environment. And I should say that the health sector is just as guilty on this as anybody else. They're just as unlikely to want to reach out across silos. So we need to work on silos. And the other thing that happens with silos is that they make it difficult for people to see the ultimate consequences of their actions. So because they're focused on their own sectors, because they don't have good mechanisms for working across with other sectors, communicating, when you do have unintended consequences from cross-sectoral feedbacks, it's very hard to appreciate those and to address them ultimately. So again, we need to work on silos. There's things that we need to do there, but I also want to emphasize that silos aren't all bad. So silos allow us to specialize. They allow us to have deep insights and deep learning and deep expertise in specific areas. So we need to have silos in a sense, but we also need ways of working and linking and thinking across them.
So then why is the city the right sort of level of intervention? Why are we not talking about this at the national level? Or maybe we are, but why is the city such an important level for thinking about this and thinking about health and getting across these silos?
Sure, and that's a good question. And I think in this case, it's a situation where it's really not either or, it's both and, right? Of course, we need healthy countries. Of course, we need healthy regions. We need a healthy world. And in fact, a lot of healthy city action originates at those higher levels. So national governments supply financing for urban health. They often supply technical expertise. They are the custodians of data that's incredibly important for urban health. Regulation and legislation for urban health usually happens at the national level. So in fact, one of the big things that we often need to think about in urban health is how do we link across those scales? How do we integrate across those scales? At the global level, of course, you have agreements like the SDGs, which also condition and shape health action at the local level and the integration of health with other sustainable development goals. But cities are closer to the people they represent, to their citizens, than those other levels of government. And they're much better positioned to appreciate their challenges, their needs, their priorities, their resources, their capacities. City governments understand local power structures. They're in a position to link to and convene the stakeholders whose attention and support is critical to success of urban health action. And of course, city governments have a mandate to work on these issues. So there are lots of things that cities can do that other levels of government just don't have the remit or the capacities to.
So just to get more specific, if healthy cities are essentially everything, right? And we have cities that have constrained fiscal space, right? They have lots of different priorities. What are some of the key issues that they should really prioritize in the health space, in the healthy cities space?
Sure. It's not easy to give a specific answer to that question because urban health is highly place-based and context-specific. So your priorities are going to depend on your local context. In general, the solution is going to be some combination of providing basic services, promoting equity, healthy spatial planning, mitigating risks, and generating social and economic opportunities. But depending on what your specific challenges are, it will be different. So if your city is in a drought-prone zone, or if it is a destination of choice for migrants, or if it has specific problems with dengue or violence or economic stagnation, those things are going to color your approach. But a good place to start for most cities is with urban spatial planning, because that determines the framework within which a lot of other stuff in the city happens. And in fact, the modern professions of public health and urban planning really co-created each other in the effort to provide and assure health in industrial revolution cities. But there are other entry points. So effective data frameworks, adequate financing for urban health, effective governance structures for urban health. Those are all things that underpin sectoral action.
Can you give us a couple of examples, right, of some healthy city initiatives that will help us to kind of understand how cities have actually done this, how they're thinking about, how they're implementing healthy city initiatives that cut across silos, that have used some of these entry points that you just talked about?
Yeah, so I think this is a very exciting time for healthy cities. One thing that I think has happened is that COVID has really opened people's eyes as to the possibilities for rapid change and for radical change that wasn't anticipated before. And at the same time, climate change and awareness of climate change is applying pressure to do things in new ways and to seek out new opportunities. So all around the world, cities right now are innovating with respect to the use of public space, different modes of transportation, the relationship, both social and spatial, between work and residence, the shift to renewable energy. So all of those are places where things are happening. In terms of specific examples, you can look, for example, and what Paris is doing to become a car-free, bicycle-friendly city, which involves work across a lot of different sectors. You can look at Medellin, Colombia, and their work to pioneering work to use participatory budgeting to help communities assess and address their own needs. Cities like Melbourne, Australia, and others are looking at the 20-minute neighborhood. So ways of organizing space so that residents of those cities can address all their needs within 15 minutes. And you can imagine that touches on a whole range of different sectors. And of course, we can't forget the many city plans that are working to integrate environmental concerns into city plans. So lots of net zero plans. The city of Amsterdam, for example, has adopted a city plan based on donut economics. So the idea that you have to provide a minimum floor of basic necessities within a ceiling, a maximum ceiling of environmental impacts consistent with the health of our planet. The city where we're in right now, Kigali, has done all sorts of things to improve environmental and human health, ranging from reducing resource use to promoting green space and public transportation. So there's lots and lots of exciting examples, but I think that it's also important to say that there's no city that has sort of achieved healthy cityhood. And in fact, that's something that in the principle is not really achievable. It's a process. As things continue to change, as conditions and contexts change, cities will also continue to need to grow and change. And so an exciting time, and we'll see where cities take us as we move forward.
So thank you. Yeah, I think, it really sort of highlights the fact that, as you said, 50% of the world's population already lives in cities, and that's only going to increase. It's clear that we really have to take a more conscious approach to designing and building our cities, because it's essential for all of our health, and that's sort of at the center, right? So, Jose, thank you so much for your time. It's great to hear your insights, and thank you all for joining us.